Hello everyone, my name is Mace and I'm a volunteer with SHINE, which is an acronym for Servicing Health Insurance Needs of Elders. And on behalf of myself, SHINE, Elder Source, and the Department of Elder Affairs, we welcome you to today's presentation of the Medicare Open Enrollment Period, OEP. Elder Affairs. SHINE is a program of the Florida Department of Elder Affairs, DOEA. The SHINE program is part of the nationwide State Health Insurance Assistance Programs, SHIP. There are SHIP programs in all 50 states and 4 U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a federal SHIP grant. The Florida Department of Elder Affairs vision is for all Floridians to live well and age well. SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed health care choices. Disclaimer. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. Area Agency on Aging, AAA. The Department of Elder Affairs administers programs and services for elders through contract agreements with the 11 Areas Agencies on Aging, AAA, in Florida. The AAAs are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with the Aging and Disability Resource Centers to provide counseling services locally. SHINE counselors. The primary duty of volunteer SHINE counselors is to help Florida seniors identify, understand, compare, and enroll in original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, Medigap, low-income subsidy, extra help for prescription drugs, Medicare savings programs. SHINE counselors also provide counseling for long-term care planning and assist clients with Medicare complaints and appeals. Through the SMP grant, SHINE counselors can provide education on Medicare fraud and abuse, including how to prevent yourself from fraud, how to detect fraud, and how to report fraud. The open enrollment period, OEP. Medicare open enrollment period. The Medicare open enrollment period could be considered the already enrolled period. You must already be enrolled in Medicare in order to make any changes to coverage. You can change or add coverage, but you may not enroll in Medicare for the first time unless it happens to coincide with your initial enrollment period when you become eligible for Medicare. This enrollment period runs from October 15th through December the 7th, with changes becoming effective on January 1st. SHINE counselors are prepared and ready to help you compare plans. Annual Notice of Change, ANOC. Each year, you receive an annual notice of change from your plan by September the 30th. This letter explains any changes your insurance company has made to your coverage and cost. Perhaps your monthly premium, deductible, or copays were increased, or some of your drugs are no longer on the plan's formulary. Plan marketing. Marketing of Medicare plans begins on October 1st. You have may noticed newspaper articles, TV commercials, or mailings advertising different Medicare plans. Take your time considering suggestions made by friends or family, as their preferences may not be the right choice for your needs. For your own protection, do not feel pressured to reply to these contacts or to attend local presentations. Understand the Medicare paths. Here is an example of the Medicare Basics handout that can be obtained by calling your local SHINE office. 2 paths to Medicare. There are 2 paths to Medicare coverage, Original and Advantage. A person cannot have both. The first path is Original Medicare, started in 1965. Types of coverage include Part A, hospital coverage. Costs include premium, no premium for individuals or spouse who paid 10 years of FICA taxes. Those with less will pay a premium. Deductible for each benefit period and coinsurance. Part B, medical coverage. Costs include monthly premium, annual deductible, coinsurance. Medigap, a Medicare supplement plan provided through private insurance companies, bridges original Medicare cost gap. The costs include monthly premium. Some plans include an annual deductible. Part D, optional prescription drug coverage offered through private insurance companies. Costs include monthly premium, annual deductible, co-payments. The alternative path for Medicare coverage is Medicare Advantage through a managed care plan known as Part C. Coverage. Part A, hospital. Part B, medical. Most plans include Part D. Costs include some health plan premiums, some include drug plan premiums. Many have no premiums. Annual deductibles vary. Copay and coinsurances vary. What can I do during OEP? Understand creditable coverage. Before looking at the options during OEP, it is important to understand the crucial term creditable coverage. The concept of creditable coverage originates through the Health Insurance Portability and Accountability Act of 1996, also known as the HIPAA law. Creditable coverage is that which meets or exceeds Medicare's minimum benefit levels and gives day-for-day credit for previous coverage. Creditable coverage helps avoid late enrollment penalties for Part B and Part D. It can be used to shorten a pre-existing condition waiting period under a Medigap policy. As we proceed, we will see how an absence of creditable coverage can be a problem. Change in RX plans. During the OEP, you can change a standalone prescription drug plan. Be sure the new plan's formulary covers your medications. Look into cost savings between buying your meds from a preferred pharmacy, or ordering them through mail order. A Shine counselor can help you with this. Add or drop prescription drug plan. During the OEP, you can add or drop a drug plan from original Medicare. If you are adding a plan and have been without credible coverage for more than 2 months, you may have a late enrollment penalty added to the plan premium. You may choose to drop Part D coverage because you already have creditable coverage through another source. Examples may include employer union group health plan, a retiree plan, or VA benefits. When the other source of drug coverage ends, it's important to enroll in a Medicare Part D plan within 63 days to avoid a late enrollment penalty. A Shine counselor can help you with this determination. Switch from original to Advantage. During the OEP, you may switch from original Medicare to the Medicare Advantage path. It is always important to compare out-of-pocket expenses when changing your plan. The cost structure for Advantage plans is much different than that of original Medicare. Check costs that may accompany doctor visits, ER visits, inpatient hospital stays, skilled nursing facilities, and drug coverage. Contact all your doctors to find out which Advantage plans they accept. Understand the rules and be prepared to follow them. You will be automatically disenrolled from your current prescription drug plan, so make sure all your drugs will be covered by the Advantage plan. A Shine counselor can help you compare plans. Switch from Advantage to Original. During the OEP, you may switch from Medicare Advantage back to Original Medicare. It is always important to compare out-of-pocket expenses. Remember that the cost structure will change when returning to Original Medicare. Don't forget to enroll in a prescription drug plan. Look for a plan that best covers your drugs. Explore Medigap options to cover the 20% of the non-covered Medicare services. A Shine counselor can help you compare Medigap plans. Switch from one Advantage plan to another. During the OEP, you may also switch from one Advantage plan to another Advantage plan. It is important to compare premiums, deductibles, co-pays, and co-insurance. Most people would rather keep their current primary care physician and must ask, is my doctor in the new plans network? Call to find out. Are all my drugs covered? You should know that each Advantage plan has different rules. Understand the rules and be prepared to follow them. A Shine counselor can help you compare Advantage plans. From a plan with or without drug coverage. When switching between two Advantage plans, one with and one without drug coverage, the issue of creditable coverage must again be addressed. If you are switching to a plan without drug coverage, be sure that you are still covered by another source as previously mentioned. When the other source of the drug coverage ends, it's important to enroll in a Medicare Part D plan quickly to avoid a late enrollment penalty. Selecting Medicare coverage. Enrolling or disenrolling. Call SHINE at 1-800-963-5337, online at medicare.gov, or call 1-800-MEDICARE. Call the plan. If enrolling in a new plan, disenrollment from the old plan is automatic. Available financial assistance. Financial assistance programs are available for individuals, low incomes, and limited resources. These programs can help you save money on Medicare and prescription drug out-of-pocket cost. To find out more about these programs and how to apply, contact a SHINE counselor. SHINE handout. Here is an example of the Medicare Financial Assistance handout that can be obtained by calling your local SHINE office. Medicare Fraud and Abuse, Senior Medicare Patrol, SMP. The following slides present an introduction to Medicare Fraud and Abuse. Senior Medicare Patrol, SMP. The mission of the Senior Medicare Patrols, SMPs, empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report health care fraud, errors, and abuse through outreach, counseling, and education. Medicare fraud and abuse. The difference between fraud and abuse is intent. 3 steps to prevent healthcare fraud. So what can you do to take charge and help prevent Medicare fraud, errors, and abuse? 1. Consider ways to prevent yourself and others from becoming Medicare fraud victims. 2. Detect Medicare fraud and abuse. Even when you do everything right, there is a chance that you could become a target of healthcare fraud. 3. If you detect or suspect fraud or abuse, report it. You will protect other people from becoming victims and help to save your Medicare benefits. Medicare fraud and abuse. Prevent, detect, report. 3 steps to prevent healthcare fraud. Here are some tips to protect yourself from healthcare fraud. Treat your Medicare card like you would a credit card. Only share Medicare cards and numbers with trusted sources who need that information to serve you, i.e., doctors, pharmacies. Do not rely on advice or offers from unknown persons who call, visit, or approach you in public. Never sign a blank medical or insurance form. Prevent. Medicare loses approximately $60 billion each year due to fraud, errors, and abuse. Due to these losses, CMS has developed a Medicare card that replaces your Social Security number with a Medicare beneficiary identification number. There are still opportunities for fraud and abuse if a fraudulent party has a beneficiary's card. The card is sent to an unfamiliar address and is used by a fraudulent party, or if personal information such as an SSN or bank account numbers is shared with a fraudulent party. Prevent. Treat your Medicare card as you would a credit card. Share Medicare cards and numbers only with trusted sources who need that information to provide services to you, i.e., doctors, pharmacies. Do not rely on advice or offers from strangers who call, visit, or approach you in public. Never sign blank medical or insurance forms. 3 steps to prevent healthcare fraud. Detect. Medicare sends you 2 notices with your claim information. The 2 notices are the following: Medicare Summary Notice, MSN, and Explanation of Benefits, EOB. These notices allow you to review your Medicare claims and check for possible mistakes. Detect. There are 2 notifications you can receive from Medicare that should be reviewed to verify that they do not have errors: Medicare Summary Notice, MSN, Explanation of Benefits, EOB. The MSN is sent by Medicare every 4 months. Beneficiaries may choose to receive the notice electronically, EMSNS. If chosen, they will receive a monthly email with a link to claims information. Prescription drug plans and Medicare Advantage plans are required to send monthly EOBs. 3 steps to prevent healthcare fraud. Report. If you see something unusual on your MSN, check with your plan or call Shine. If you get a call from someone requesting your Medicare number, do not give it out. Call the Federal Trade Commission at 1-877-382-4357 and your local law enforcement. If you believe you are a victim of fraud or abuse, contact your local law enforcement and Shine for more information. Red flags on an MSN. Your Medicare Summary Notice, or MSN, is very useful for detecting fraud. Let's review the 5 highlighted sections that will help you check for fraudulent Medicare charges. 1. Your visit. This section provides information like the date you went to your doctor. Keep your bills and compare them to your notice to be sure you got all the services listed. 2. Service descriptions. User-friendly service descriptions will make it easier for you to know what you were treated for. 3. Approved column. This column lets you know if your claim was approved or denied. 4. Max you may be billed. This is the total amount the provider is able to bill you. It's highlighted and in bold for easy reading. 5. Notes. This section refers to explanations of your service as listed at the bottom of the page. Next, let's look at the sections highlighted in red for examples of what to specifically check for. Is this a provider you know? Did you receive services on this day? If you live in Connecticut, did you really receive services in Ohio? Do any services appear twice when they shouldn't? Report. If you see anything unusual on your MSN, check with your plan or contact Shine. If you receive a call from someone asking for your Medicare number, don't disclose it. Call the Federal Trade Commission at 1-877-382-4357 and local authorities. If you believe you're a victim of fraud or abuse, contact local authorities and Shine for more information. Questions or comments? Please hold any questions or comments until the end of the presentation, and with time permitting, I'll be glad to answer them for you. Shine. Shine counselors offer free and unbiased assistance to help seniors identify, understand, compare, and enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, Medigap, low-income subsidy, extra help for prescription drugs, other public and private health insurance. Contact the local Shine program. Elder Source. The local PSA 4 Shine contact in Jacksonville, Florida is Elder Source, located at 10688 Old St. Augustine Road, Jacksonville, Florida 32257. The phone number is 888-242-4464. Tell us how we are doing. Please complete the short survey at the URL listed here, tinyurl.com/survey4shine, and tell us how we are doing. End of presentation. Lastly, on behalf of myself, Shine, Elder Source, and the Department of Elder Affairs, we appreciate your time and participation in today's presentation. Our goal is that this presentation has provided an insight into the value of being educated and to better assist you with your Medicare endeavors. Thank you.